Hey, it's Jessica DeMassa with WTF Health. I'm here at the HISA studio at HIC 2019, and joining me right now I have Dr. Margaret Kennedy. She is the Chief Nursing Informatics Officer at Gevity Consulting. Margie, great to have you here.
Thanks so much. It's lovely to be here.
Okay, so you are a change management guru, and you are somebody who has been tasked with, I think it's a pretty arduous task, of getting clinicians ready to have the capacity to take on this digital transformation of healthcare that we've all been waiting for. So this is a big job. And so, I guess, top level, what's the biggest challenge about this?
Well, it's interesting because historically IT projects have focused on rolling out the technology and haven't really thought about this notion of how people respond to change. Change is stressful and it's daunting, and people have lots of different motivations around change. And if we don't manage that on a proactive basis, it really is one of the most common ways that a project can fail. So change management is the actual domain of practice where you actually focus on leading people through change in a successful, empowering, and humanistic way.
Okay, and now as far as healthcare is concerned, this has got to be really challenging because, it's like the old adage, like, how hard is it really to teach an old dog new tricks, especially when it's somebody like a doctor who's been used to practicing medicine for a long period of time and their training was, a certain way, and then now they're living in a system that's done a certain way for, either malpractice reasons or risk mitigation reasons. How do you teach them to trust some of these digital therapeutics or digital solutions that are coming their way?
Well, there's actually two reasons that you might engage with a clinician who's facing these kinds of challenges. Number one, their organization has determined that we're going to make this change because of a specific set of reasons. Number two is we don't practice the way we used to practice 25, 30 years ago. And so the way we delivered babies that in that period wouldn't work today.
Right.
And so we have to respond to those kinds of changes. So change management actually leads you to the question of what's in it for me. Mm-hmm. And so clinicians, whether you're just out of university or whether you've got a body of experience that spans decades, have to really understand the value proposition. So that's where change management actually comes in, and that's where I spend a lot of my time.
Okay.
That and ensuring that resistance is managed in, again, a proactive, empowered way.
What are your tips for better communicating that value proposition so that you can get the buy-in that you need? And I'm sure that this is something that those who listen, anybody who's in a change management type job, regardless of if it's dealing with whoever it's dealing with, how do you do that in a way that resonates and actually gets people to say, all right, this is a good idea, I'll buy in on this. How do you communicate that value proposition?
Well, the number one success factor for any change initiative is an executive sponsor that's engaged, visible, and vocal throughout the process.
Okay.
So it's not good enough to do the initial launch and then disappear. You have to have skin in the game, and you have to be visible all the way through. And it's the organizational leadership that shares the vision and creates a coalition of support and change champions across the organization that will start to create that momentum and shift. The other thing is that from a what's in it for me perspective, clinicians are rarely motivated solely by money or solely by time savings. So we want to know that we're delivering better care. That's really the number one most powerful motivator, I think, for a lot of clinicians.
Sure.
And when you can actually support clinicians from a change perspective, from a training perspective, and from an elbow support perspective, they actually make great progress.
What about around the clinician? The clinician, obviously, they've got their benchmarks and they want to deliver good care, but there's a gigantic support team around them, oftentimes because so many of those systems touch other people who have administrative jobs and aren't even patient-facing. When it comes down to the way they're measured on their employee scorecard at the end of the year, to get a raise or a promotion, how in alignment do those things that incentivize those workers have to be with some of the changes that are coming down the pike?
You've hit on a real nerve because I don't think we're there yet.
Okay.
And I think organizations largely have not recognized the burden of responsibility and the level of effort that it takes to engage in these large-scale change initiatives. And we don't really reward that in a way that's meaningful and tied to compensation. So it certainly is an area for growth, and I think organizations need to take a critical look at that, and maybe it's going to take some uncomfortable conversations to really look at how we approach that.
Is there any point when you've been working with people where they're so adverse to change where it makes sense to just stop and perhaps transition them to a different place? And if so, like, how do you handle that? Because I'm sure that comes up. It's just some people are not meant to just, for whatever reason. And so how do you handle that? Because that's one of those difficult, like you said, a difficult conversation. It's a difficult realization to make. So how do you do that? Especially as our industry is really going through a time where the change is only going to get more prolific as we continue to move forward here. So if you can't get on the bandwagon now, what do you do?
Well, resistance management is a core component.
Resistance management. Oh my God. I love that. It's like a diagnosis there.
It is. It's actually quite interesting. Any change, you want people to come in an empowered, an excited, and a motivated perspective. And you want to incentivize people positively. On the other hand, you need to have a resistance management plan in your back pocket because not everybody will share that kind of enthusiasm initially. And there's lots of reasons for that. People can be intimidated about the technology. They can feel that they may not be able to learn the technology and they may look foolish in front of colleagues. They may fear the loss of their job. There's lots of motivations that could incentivize people to think this is not for me. On the other hand, I think from a go-forward perspective, there's a space for us to really look at having difficult conversations, our executive sponsors saying, this is where the organization is going, and really being able to position this to employees that if you're unable to commit to this strategic direction, you have some choices to make in your career path. And only once in my career have I ever seen a termination because of complete resistance.
Right.
I have had lots of people say, I'm going to quit, I'm going to resign, I don't want to do this, I don't want to listen to what you're saying, and actually be very disruptive in training sessions. And I'll relate one scenario that was quite uncomfortable. And this was a very seasoned public health nurse who was very vocal in a very negative way. And we did the whole training. I did a lot of one-on-one with her.
Sure.
And it was really boiling down to verbal abuse. But we got her through it. And 2 weeks later, she called me and she apologized for her behavior. And she was actually feeling quite badly. She said, I cannot believe how long we've worked without this technology, and I would never give it back.
Oh my goodness, I've got goosebumps.
So it's amazing.
Wow.
But you do encounter resistance.
Yeah, sure.
And the first
scary.
step is to have a conversation about what you're skeptical and concerned about.
Sure. All right, last question for you. I do want you to weigh in on this. So we've been talking a lot about retraining the older generation, but how do you handle the newer generation that's coming in? And maybe even talk about a little bit the older generation working with those millennials that we hear are, they work differently than the rest of the previous generations have. And so how do you get them excited about a healthcare job or a healthcare IT job, and how can these seasoned veterans who are there to welcome them, how can they make that a little bit more appealing?
Well, I think there's a really unique opportunity here with millennials who have grown up in a culture of technology. And in any change initiative, you need change champions and you need super users, people that have a little bit more advanced training on the solutions who can act as supports and mentors and ongoing trainers for the staff at large. Our young millennials fit that bill precisely, right? And so there's a reciprocity that occurs between the various levels of experience with our new folks coming in that are technology savvy, supporting the very seasoned clinicians who have that wealth and depth of clinical experience that the millennials currently lack. And so when you start to create that kind of alchemy, then that's where magic really happens. And you see the reciprocity that happens, and you can start to see our super users exploring the clinical dimensions that our seniors really bring. And so it demystifies the technology, it demystifies the clinical depths and experiences that need to be shared, and it really creates a win-win situation. That's not a short-term process,
right? And
it takes a lot of effort to get there, but the payoffs are astronomical.
It's actually fun talking about work with you. Especially the demystifying of technology. I think that's just great. Margie, thank you so much for joining us and for sharing with us your perspective on this. It's so interesting. Thank you so much. I'm Jessica DeMasso with WTF Health here at the HISA studio at HIC 2019. Thanks for joining us.